In the case of these two doctors, was it necessary, since they were already in self-isolation, since they tested positive?
No. There's no reason, because they were adhering to the national guidelines, which is also coming from the WHO, and they were self-isolating, and there was no one else staying with them in their home. It's only the two doctors.
The head of health has said that they were concerned that these two doctors, although they operate in Limpopo, are based in Mpumalanga, and this movement would render them susceptible to further infection or even passing on the COVID-19.
Well, if you are self-isolating after you have been diagnosed, then it doesn't matter where you live. You are now in your house as per the rules. It's 2 weeks self-isolation. So it would be extremely difficult to bring the disease to anyone else if you are staying in your home. Before that, before they have been diagnosed, they would have been working like any other doctor in a facility. And any other doctor can be susceptible to contact COVID-19 from patients. So it would be difficult to say that you are now bringing it from one province to another province. That doesn't make any sense.
How well can one or authorities, how can authorities regulate or monitor self-isolation?
Well, the rules are clear, or the guidelines are clear. If you are self-isolating at home, there must be a medical service or a caretaker or care worker. I'm not sure what the naming of that person would be, to go out once a day and make sure that you are adhering to the rules. Temperature's been taken, this and this that you need to fill in.
So,
and as long as you abide by that and you're not getting symptoms.
So you're accusing authorities of the violation of human rights. How far are you going to take this?
Well, we'll see what comes from this court case, because this raises a serious question regarding your human rights. It doesn't matter whether you are a doctor or whether you are an ordinary person out in the streets. So that is a problem, and it's also not in line with the WHO's guidelines. The second thing is, if you're now starting to say that you are going to isolate or self-isolate all patients who is positive in your province, then you must make sure that you are now consistent and that you have enough facilities available to do this.
Is Sama in contact with these doctors? How are they?
Well, they were still fine, but you know, but you can hear emotionally this is having its toll, and you know, if you listen now from a doctor's side, because this is not only about doctors, it's about the right of the nation as well. But from doctor's side, you can hear they're going down emotionally, and they're very young. So this is a traumatic experience that they are going through. And we cannot afford this. The doctors are extremely unhappy in the background about the way their colleagues have been treated.
Well, thank you for talking to us this morning. The spokesperson for the South African Medical Association, Chairperson Dr. Angelique Coetzee there. A very multi-layered story that on the one hand looks at the human rights of individuals, and on the other a country in a state of disaster. We'll continue to look at the different elements of this story